blood test shows you have damage to your heart. Okay. Now we need to do a cardiac catheterization to see how bad it is. Okay. Now, if we find a blockage, if you find a clot or anything like that, we need to put a stent in it. Okay. If I put a stent on it, then what's going to happen is operating on him is going to be very difficult because he's going to be on blood thinners. Okay, aspirin and Plavix. From cardiac standpoint, we need to answer a major question: what the long-term plan is for you guys. What's going to, if you want to go with the surgery, if you want to go with the chemotherapy, if you're going to go with radiation therapy or not. Okay. It seems that this is advanced prostate cancer, and it seems that it has involved the rectum, the bottom part of the colon. And
do we know for sure that that is cancer in there?
Right.
Here's the deal. No, probably it is, because it cannot be anything else. But if you want to definitely do that, you have to do biopsies on it. Okay. So, but if you're asking me, it walks like a dog, it sounds like a dog, so it's a dog. Okay. So it looks like yes. The answer is probably it has invaded the rectum.
Right.
Now, but if you want 100% accuracy, you have to have a biopsy from the rectum, try to make sure a colonoscopy and
which means surgery.
No, the biopsy is a colonoscopy for the time. It's not a surgery. Okay, they can do it just to go over the colonoscopy there, and then they biopsy it and they confirm it.
Okay.
The question is, it itself has a risk in it, and then what if you want to use those information? It's worth it to do that. If you don't want to use that information, if he says, I don't want any treatment. That's what the message I got last time. I don't want a chemotherapy, radiation therapy, surgery, end of story. Then I think why you want to expose him to the risk of the colonoscopy and biopsy from the rectum.
I understand that, and that was Daddy's decision when he first found out he had the cancer.
Okay. Now, let me finish it up and then we'll go, because I know what Mary told me about it. Now, at that time, his cancer was a prostate cancer. It hasn't advanced so much. It hasn't affected his quality of life. He didn't care about longevity of his life, but he wanted to be happy. And now it has affected his urine output, which Dr. Lee had hopefully helped about significantly. And then the question is how to improve the symptoms of fecal impaction and bowel movements, okay? Because this is going to close, and it can be very dangerous, okay, and very uncomfortable. So I think because of that, he has to see if he wants to change his mind or not. Now, if he wants to go with medical treatment, what I would do it is, if he doesn't want to do anything, I think he probably needs some sort of divergent to her bowel area, whether to put from small intestine or big intestine or whatever they want to do it. They have to put it so all the food goes there. It comes from somewhere. Otherwise, it's going to be obstructing the intestine, and he's going to have a major complications. Okay, so that surgery is a minor surgery, a colostomy or so. And if we want to go that route, what I want to do it is, even if he wants to stent, unless it's very dangerous, I'd rather them do the procedure, knowing the fact that the heart, it's a high-risk procedure for him, but we let them do the surgery, and then after that, if he needs a stenting, we stenting to prolong his life. Okay. Now, if he wants to say no, I want to do everything. Okay, the everything is a major decision. He has to have a colonoscopy, then he has to see oncologist. He's probably going to need a chemotherapy. He's probably going to need radiation therapy, and that needs a major surgery. And putting a stent, if he's going to get a chemo radiation therapy, giving blood thinners with a low blood counts on this chemotherapy medication is going to be very high risk. Okay, then we have to make a decision which one. I mean, we might probably say we'll just go with medical treatment at that time, if possible. So, from cardiac standpoint, I think he needs to have a cardiac catheterization to pinpoint exactly how bad it is. But I cannot make that decision whether to put a stent or not, pending knowledge of what his plan is for his prostate and colon cancer. Okay, so what we were planning to do for the time being is take him to the cath lab, take a picture of it. Now, if you think this, his life depends on this, putting a stent or so, I'm going to put a stent anyway. If there's something we can wait, I'm going to wait for your answer to tell me what you guys want to do long term.
Mm-hmm.
Okay? And that's going to be a major decision making for us, whether put a stent, not put a stent, treat him medically, put a non-medicated stent, put a medicated stent. So these are technical things we have to know before we expose him to the risk of this stent. So in summary, we need to reconsider his decision either way, to go conservatively or just go aggressively, or just go palliatively, just open something here so we feel comfortable. Okay? And he needs to have a cardiac catheterization no matter what. And what to do with that cardiac catheterization depends on his decision making.
Can I talk now?
Yes.
My concern yesterday when I heard all of this was we're being asked to make a decision as to what he wants to do with this aggressive cancer without knowing exactly where all this cancer is. Why can he not have a bone scan to see if it has gone into the bone? The biopsy to see if it has gone into the colon? Why can we not have these results in order to help us make this decision?
We already ordered the bone scan.
Yeah. But
He
here's
will
the deal.
have the bone
Here's
scan.
the deal. Look at from our standpoint. We were told he had this, we know he had a cancer.
You were told that from a while back.
But we don't want to do anything, and he doesn't want to do a chemotherapy or radiation
Has
therapy.
anybody asked him that lately?
Yes, we
Yes,
talked to
we
him.
talked to him.
4
And I
weeks
talked
ago.
And what did he say?
Well, he yesterday I talked to him. He was open to idea of being more aggressive, and that's why we.
The last time I was in here, he was also.
Okay, so the whole idea is here. Listen, it's a very difficult decision to make.
Mhm.
Okay, number one, it's very complex information for him to digest.
I understand that.
He's competent. He, from my standpoint, he can make his decision. I've known him for 3 or 4 years. I know him very well. And the thing is, if it's me, I want my family to be around. So I want their support and their input to make my decision. That's the whole idea was there. And
Right.
then because treatment, no matter what you do, is going to be difficult.
Right.
Okay, it's going to be a complication of bleeding. It might be a stent thrombosis, a heart attack or so. And this creates questions to the family if they're not knowledgeable from the beginning. The whole idea was to get everybody here, everybody understand everything from A to Z, know what's been done, answer all your questions. We give you time to communicate with you guys. You help him out. You guys come with a decision, which is based on his decision, which is he's competent to make that decision. And then we adjust, we modify our treatment to the best of his wishes. Okay, so that's the whole idea. And I was a little bit disappointed we don't have everybody here, but I hope.
Well, you would if we would have been told when everybody was going
That's
to be
fine.
here.
There's no problem. But I give him my
But we
perspective.
weren't
He knows
told.
about it. I talked to Mary. He knows the cardiac perspective, but with Dr. Kundi's perspective is very important. The surgeons, the urologist is important, and this is a teamwork. Unfortunately, this is not something in the cardiac-wise. I make a decision based on cardiac. My decision depends on other people's. Other people's decision based depends on me also.
I understand that. And our decision depends on everything y'all tell us.
Exactly.
So, you're going to do it the picture.
We're going through the picture.
You're going to see what kind of shape
It is.
that is in. He's going to have the bone scan. We're going to see how extensive the cancer is.
I'll first of all, the answer to your first part is yes. I think we better go ahead and do that. Find out how bad it is. Then the second question, it depends, because we got this message. If you see rectal colonoscopy, they can go there and perforate the colon, okay, and that's a disaster for him. So anything we do carries a risk with it.
I'm talking about just the bone scan right now.
Bone scan, we can look at bone scans,
Right.
but here's the deal: if he doesn't want to have any chemotherapy, radiation therapy, I think bone scan is not going to change your management.
I understand that, and I understand the decision of whether or not he has it could depend on how well what kind of condition his heart and everything is in.
And
Okay?
then part of it, and a part of how advanced the cancer is.
Exactly.
So we need to get a cancer specialist. We need to get a urologist, and you get a stomach doctor, and probably a GI guy a colonoscopy guide, so they have to make a decision first of all from their essentially how advanced it is. It's not just you do a bone scan and just make a decision. No, there are other things you have. You might end up needing.
I understand that, but I have had experience that if it's already in the bone, then that would be a big difference.
Even that, honestly, there are palliative chemotherapy, palliative radiation therapy, and I have personal experience from it. My sister had rectal cancer. I know very well about these things. I've done very good, extensive from personal standpoint. Even if it's very advanced stages, there's still chemotherapy has a palliative role. Radiation therapy has a palliative role. Okay, but by just trying to do one test, one test or two tests, then we make a decision. That's a bad idea. If the question is, if you want it, I think he can have an oncologist seeing him. He can have a stomach doctor seeing him. All of them come together, get a plan for you, and then tell them how advanced it is, and this is our recommendation. You want to go for it or not? But the reason we haven't done that because we were told he knew about the cancer, he doesn't want any treatment. So if he doesn't want any treatment, he doesn't want to use those information, we don't want to expose him to the risk of all these procedures.
Okay, but again, you're going on what he said years ago.
No, as of yesterday. Initially, before they talked to me.
As of yesterday, he said he didn't want treatment? As of yesterday,
I know him very well. And
Daddy, did you tell the doctor you didn't want treatment yesterday?
I told him we had to do something. That's all I told him.
That's fine. You don't want to put him on spot. I know him very well. I know him very well. We discussed it, and I came by to try to change his mind. I talked to Mary, but I don't want to impose my opinion on him. That's why I want you guys there. So right now the idea is, where do you want to go? If he's okay with your chemo radiation therapy, in case we agree with it, if you expose him to all this risk of colonoscopy or so, I think that's, from my standpoint, my perspective, I think it's appropriate. His mind is there. I think he enjoys life. I think it might be a good case. But that's my perspective. He has to make that decision. You guys make a decision and then help him out to make that decision. So from the cardiac standpoint, I hope I gave you my perspective. And Dr. Balapuram, you have your own perspective also on anything else. I wish Dr. Lee was here also. Dr. Kundi was also here. So they give you the perspective, so you have all the answers to your question. Do you have a question from cardiac standpoint?
Yes, what are you going to do today?
Irrespective of what decision he makes, I want to see how bad this is. The heart
When is that going to be done?
We try to get it done today. Now the next question is, sometimes when we're there, we just fix it. That part I'm not going to do it. Okay, because I don't know what we're going to end up. If I fix it, then he's going to be on aspirin Plavix. Dr. Kundi is not going to be able to do any surgery. He's not going to be able to get a chemotherapy. He's not going to be a radiation therapy. Then I will postpone it. If it's nothing urgent, I'll get all this knowledge and then see if he can have the surgery or palliative surgery or chemotherapy or all these kind of things. And then bring in the table, all the people make decision. Everybody now knows how bad his prognosis is from cardiac standpoint. And then they come up with a plan and he agrees with it. So that's what I want to let you know. If you have on the table 90% blockage, I'm going to go fix it while you're there. In his case, I'm not going to do that.
I understand.
And that's the main reason, because I don't want to prohibit him of having another surgery, because he's going to be an aspirin Plavix. And if there's something minor he wants to do, not major radical like surgery or take the prostate, the rectum and everything out, then if it was a minor surgery, we'll let them have a minor surgery done with some risk, and then we can always go and fix it.
Let's go your route.
Sure, we're going to go your route, but I just want to give the perspective to everybody.
You the doctor.
Do you want to take time, talk to him, and we will come back and readdress this today at whatever time you were?
Daddy wants to live. I've already talked to Daddy.
Okay.
Marianne has talked to Daddy. Daddy has totally changed his mind. When he was, and that's why it really surprises me for the doctor to say that he had said he didn't want to do anything, because I haven't heard that since he's been in the hospital.
Well, He told us the same thing too. Remember?
That
And I
he
finally
said,
had
well,
to
whatever you
convince-
got to do.
I finally convinced him at least to see the oncologist.
Right.
And we had to reassure him not that they will do anything. So kind of gave us the same impression.
That he wanted to do.
No, he didn't want to do anything. But I
I
had
was
to
in here
convince-
when he talked to you.
Right, but
He
I had to
said,
convince her
well,
oncologist to
whatever
see
it
him.
takes was his answer. That's, Daddy's scared. When Daddy was first told, I think he was really in denial. He has great faith, and I think he was just going to live on his faith.
Okay.
And
And I have for about 8 years.
and now that he's in the hospital and he sees what he's up against, he's scared and he wants to fight it.
Well, we'll come back then. Just talk to him and let us know what you think. We're like Dr. Kosh explained in such a great detail. We're here to do whatever your family and him make a decision. Just let us know. We're here to help you all through. So do you want us to come back at certain times so we can have a discussion? Like maybe we three can come back and.
I think we've had enough discussion.
Mhm.
I'm ready for something to be done.
Yeah.
I think before we have any more discussion, we need to get these results. I mean, he sat in here for a week without anything being done.
No, that's not true though.
Well, he had some tests, nothing was done.
He had the TARP surgery. He had the surgery. He had the.
And we waited
After a week.
The plaque
That's what
support
you
had
have
to
to do.
wear out.
They have to wait, otherwise it's going to bleed to death.
Bleed to
from-
death. Yeah.
And should you have been contacted when they took him off the Plavix?
It depends on the physician's decision. Some people do it, some people don't do it. It's not a problem. And here's the deal. Again, these are not very straightforward decisions. If you want to do on the process right now, if they take him off Plavix, if they hadn't taken off Plavix, okay, he would have faced major bleeding. He already had 2 units of blood.
I understood why they had to take him off.
No, the problem is either way you look, it has its own. It depends. I mean, you're Monday morning quarterbacking. Okay, now that it's happened, maybe we shouldn't have to stop the Plavix. Now, had it bled to significantly, man, we should have stopped the Plavix. These are the things. Honestly, it's very gray zone, and you just use it's an art. It's not a science. And the decision, physicians who's managing it, we trust them. And then either way, probably he would have. I would have stopped the Plavix. Okay, maybe just go with aspirin or so. But these are maybes. If it wasn't aspirin, maybe he was like
Okay.
10-20 units of blood by now.
Okay. I'd like to get to know what kind of shape his heart and stuff is in as soon as possible. I'd like to know how widespread the cancer is as soon as possible. And then we can make further decisions.
Sure, I think that's reasonable.
Okay.
We have scheduled him already, but I want to make sure.
Wonderful.
If you already scheduled him.
What
And
time
there's
is
another
it scheduled
there's another
for?
decision also. Where do you want to get this? This is a very complex chemotherapy. If you want to go with chemo, radiation.
It'll
or
be
so.
at MD Anderson.
That's the other thing. I talked to Mary also. Okay,
Mhm.
she also brought up. I think there's 2 ways of doing it. One is just right now prostate problem is hopefully fixed. Okay. Now the rectal obstruction, we don't know how bad it is. Okay. Now Dr. Kundi is going to make the decision. If there's anything conservative that we can do, like a clear liquid and enemas or so, it works there. We might be get away without the surgery or so.
Mm-hmm.
But I want him to. Of course, he needs to have a cardiac workup. Then we need to get him involved in MD Anderson. So that's one thing, from the beginning. And if you want to go with MD Anderson, no matter what, I think the earlier you start with them, because they don't accept their other places, chest CT scans, MRIs. They do their own things.
Mm-hmm.
So or colonoscopies or so. So if you want to decide to go that route, one alternative would be also trying to get an appointment with MD Anderson and let them manage this. That's another alternative. The only question is he healthy enough, safe for him to go? write this down. We have to fix it, make sure his heart is okay.
Right.
And the next question is going to come by. I don't think the prostate is going to be a problem, but the problem is going to be the intestinal obstruction, how bad it is.
Right.
And then if there's any way we can just buy some time so you guys get hooked to MD Anderson, that's the answer Dr. Balaparon, Dr. Kundi, and other people are going to give
Why
you.
can't I just do it here?
You can.
Do you want to just do it here, Daddy? Because I'm not going to make you go.
What?
I said, would you want to just get everything taken care of here?
Yep.
Okay, that settles it.
And forget it. I know they're good.
They're excellent.
And
So then let me go ahead and ask an
Well, why
oncologist
can't I-
here, Dr. Medin is fine.
put it in y'all.
That was my mother's, yes. That
Okay.
would, she would be fine.
Yeah, I remember that. So
Yes.
let's go ahead and call her. Get her
Already
input.
got it all.
Wonderful.
Okay.
Okay.
Any other questions?
So when is he scheduled for?
We're scheduled for today. We're waiting for you guys. Yeah.
Okay, but we don't know what time yet.
I think we can arrange it. I think we can get him next case. It's no problem. We're waiting for him.
Wonderful. Okay, and the bone scan?
Now, this cardiac catheterization also with him, you have to understand, there is about 2-3% risk of kidney failure. There's a 1 or 2% risk of stroke because of the catheters or so.
Right.
And those are just the routine things we tell everybody. So in his case, a little bit higher, but that's what we end up going. And then we'll do the procedure, and hopefully they'll give us some insight. We looked at his previous 2012 cath.
Mm-hmm.
He had a stent there and 2 angioplasties before. And I bet one of them are closing, so we'll let you know after that. But this is also a very high risk procedure, you have to understand.
I understand.
Okay. You have any questions?
I just gonna say my wife she passed away, but she had everything done here.
They're gonna contact Dr. Medina, the same one that Mama had, Daddy.
Yeah.
She was a real good doctor.
Well, that's tied into this hospital.
Yeah, she is.
I mean, yeah.
Okay.
But I'm gonna just follow her.
No
Okay.
problem.
Thank you very much, Dr. Costa.
Thank you, guys. Thank you. Sure.
Thank you. And the scan is scheduled for when?
Well, it's not. If he goes to CAT, then things might get delayed. It might
Okay.
be later today, or radiologist might say, "Hey, we need so much time to do it, so we can do it tomorrow."
Okay.
morning." But we'll
Well,
double check
why
for
was
you.
why was he so upset that the family wasn't here when we weren't told?
Well,
I
do you
would
guys know
like
anything
that.
about the family meeting? Because someone told
I'm
me
Kathy, I'm
actually.
social worker Lisa, and Susie, our case managers. Larissa, I guess you spoke with her yesterday about scheduling
It's my little
it?
sister that was here.
Okay, she spoke with Larissa, who works here on 3 West, and I read her note this morning, so we're just coming into this, but she had said that she called all the docs about a meeting between 1 and 3.
Right, we were told that, but her question is, they weren't told it was 1.
We were
and
never
3.
told.
Their question is that, so I.
So how can we be here if we're not told
Oh,
what
you weren't
time?
even told a meeting was set up at all?
No, we were told there was going to be one set up. We
the
were
time
never
was
told
not.
that it had been set up and what
Oh,
time.
okay, so she never got back to Mary, your sister or something?
No.
Yeah, because she spoke with the mayor.
Sorry things got lost, but you were here. You're the power of
Mhm.
attorney. That matters. Of course, Mary, we talked to her yesterday. Kind of
Right.
gave her a brief synopsis about ongoing heart-related issues. And also, just so that you asked a question, Plavix was stopped because at that time that was deemed like more emergent surgery because we were worried of the colon rupture.
I remember that.
Right. So that's the reason we had to stop it. And usually we try.
I
to...
understand why you stopped it.
Okay.
Stop
All right.
what?
The Plavix.
Oh, okay. Yeah, I do too.
Yeah, I just want to clarify because I don't want any ifs and buts in our conversation here.
No, I understand that.
All right, Denise, do you know, so Dr. Karch said he might go to CAT? Right, so let us know once he's back, so that we can start coordinating from there.
Okay,
Dr. Medin will be consulted, so
Okay.
she will be updated about his case.
okay, Dr. Cooney said whatever you have to say, let her know.
I will, of course, we're communicating, so I'll let her know on from my perspective.
Okay, that's it, sweetie, you got it all. I think you got it all.
And then also talk to Dr. Kundi if we can get a rectal biopsy to clear off our brains, if that's possible.
Yeah, I mean we're being made to make decisions when we don't know everything yet. That doesn't make sense to me.
Well, the main idea of today's is just not really asking to make decisions without information. It's just how aggressive you want to be with treatment. If he's okay with chemo radiation, we'll go ahead and get all the input you need so that you can take an informed decision. That's pretty much what we wanted to know now.
Daddy, you know before when you decide, when it was just going to be radiation and you thought it was going to be what Mama had, and you said you did not want to go through that. You weren't going through it. Now it would be. It's not the same necessarily that Mama had, but it would be a form of chemotherapy and radiation.
Whatever.
You want to do that. Would you be willing to go through that? I will be with you. I'm not going to, this is the time when I stay with you.
Well, when will all this take
Once
place?
we find out for sure.
Sorry, he's making a decision about how to
Once we
proceed
find
from
out
here.
for sure. Would you want to? If it came to it, are you willing to do that now? Or would you rather not do it and just let the cancer go,
What cancer are you talking about?
whatever cancer he's got?
Okay. So
Would you be willing to?
Whatever it takes.
That's what
so
he
you
keeps
would
saying.
like to proceed with the treatment options. We'll go ahead and proceed with it. More testing, more investigations.
I don't,
Mhm.
one thing I don't understand all this ain't even what I come in here for. And I got hit with all this.
Yeah.
And I can't get my mind straight.
I'm sure.
Hey, wait, but before you go, the cancer people are talking about. I mean, there's only one cancer that's diagnosed as a prostate cancer.
Right. That's what we're
right?
talking about. We didn't talk about any other cancers.
Yeah, I mean, the other thing is, you know, kind of up until this point, it looks like whatever is causing the blockage down there, I'm not sure if that's been totally evaluated, worked up. I mean,
Nothing's
right?
been done to it.
Yeah, and that one right there, I mean, that could just be something as simple as like a stricture or something like that, you know? Y'all have
Right.
GI seen him or no?
Well, that's what we're talking about today,
Yeah.
getting a GI involved, Nadine, and about the treatment options. And Dr. Kundi may be trying to do something if it's a stricture.
Well,
or
I think, you know-
biopsy
And his
there.
cardiac doctor, surgeon was just in here, and he basically said, well, admit it. He basically said, oh, it's probably bound to be cancer in his colon.
Mm,
I mean, that's what he told us.
Well, he was trying to. He said to get a biopsy first and have a colonoscopy.
But it was
it
the
very
old, well, if it
could-
looks like a whatever and walks like a whatever, it's probably whatever.
let's say not necessarily, because I mean, when you came in here, you have some trouble. It's not like you're bleeding, right? You're not having bleeding correctly,
No,
right?
no, it was obstipation.
It's like and you have previous surgery before. I mean, you know, what are the facts here? You know, you have prostate cancer. That part alone, I think we can treat it. Once you get done here, I give him some Casodex already. We can give him some Lupron shot. They can kind of hold you back, okay? And but the other part there really has to. I'm not sure. I'm not an expert with that. But you know, really, GI needs to be involved with that. Not oncology at this stage. You get it dilated, go colonoscopy, and if it's a stricture.
But oncology is for prostate cancer. Do you
I
want
do-
us
no,
not
no,
to
no,
call them at all?
But I can deal with the
For
prostate
that?
cancer.
You see,
Yeah.
I agree with Dr. Lee.
I can deal with the prostate cancer.
It's like we're being told to make decisions when we don't even know that it's that or not. I mean, he's wanting the whole family to come together now and basically make a decision. Are we going to do something about this, or are we going to let him go? And I don't agree with that when we don't have all the answers.
So still, we're trying to see if the blockage is related to a mass or a stricture or something. That's what you're still trying to
Yes,
say.
I would-
Exactly.
I
So
would
we're clear about that. We still
evaluate
don't
that.
know what the rectal thing is. We're trying to get a GI doctor. That's what Dr. Lee's suggesting, to go in and take a look and get a biopsy if possible, if they
Yeah.
find anything. Still, we're not sure yet. So we're trying to make that workup in progress.
That's what we should do.
Yeah, I mean, because off and on, you know, he's soft and then he gets a little extended. But if it's completely blocked off right now, two things. One is he can have some blood from his stool, right?
Exactly.
Plus he'd be super bloated now, you know? I mean, something like this, I mean, I'm a urologist, but it's something that can be pretty easily, yeah, I mean, just have rectal dilation here. You have
Let's just get the GI to do
yeah.
a scope and see if there's a mass or if there's a stricture or if there's something else going on first, and then go from there. Okay?
And take a sample and do a biopsy.
Exactly,
I
that's what I'm
don't
saying.
wanna
They will
jump
take, if
into
anything is
that,
abnormal, they will
and-
definitely take a sample there, okay?
Like he was talking about, I mean,
Yeah, because of
he's
that,
got it all nailed down.
Well, I'm sorry, Daddy, but I think he's pushing us too fast.
That's what I'm talking about, right there.
He's going to go
Dr.
in
Lee
now.
he's got the right idea.
Yeah, I agree. The cardiologist is going to do the calf, but he's agreed that even if it's 90% blockage, he's not going to put anything there because he doesn't want to put him on Plavix again.
It was just
Okay.
to make sure, because if, let's say we find something unlike what we expect, let's say there's a mass in colon or rectum, something we do find something, then putting a stent will preclude him getting any surgery, so that's his concern.
I understand that. So we'll know what kind of condition that's in as far as his heart is concerned. Now, how fast can we get this other thing done? Because this is the part I'm saying, he's been in here a week. Well, he was in here a week. Nothing was ever done. We kept waiting.
But
Nothing was ever done for the thing he came in here for.
Well, I still want to reiterate that fortunately he was on Plavix when he came. We have to wait for at least 4 days before we can do any kind
Okay.
of procedure. So that's where we got
So
stuck.
back to my question now, when are they going to,
Let
when
me
can
talk
they
to
do
the GI
the other?
doctor, and I'll get back to you maybe around 2ish. Are you still here then, or are you?
I'll be here.
Okay,
Yes.
so let's talk to the GI doctor, see how quickly they can get him to do a
Keep
scope,
it
okay?
in your mind.
Okay.
All right, Mr. Taylor, we'll come back and talk to you in a bit, okay?
Okay.
If you need to discuss anything else with him, just let us know if any updates come through in between, okay?
Thank you.
Please.
Yeah, she did take it to the computer.
Okay.
I'm Lisa. What is your first name?
Laura.
Laura. I'm the case manager. Now, this is my first day to have your father. I totally apologize profusely for you not knowing what time this meeting was going to be because Larissa set this up
Mr.
yesterday.
Taylor?
Larissa happens to be off
My
today
name's
because
Joe.
she's working the weekend.
Pleasure to meet you, sir. I'm here to take you to Kaplan. Doctor says he's ready to do your procedure. If that's okay from what I hear from everybody else
Oh,
in
yes,
the room.
yes.
I want you folks to say yes or no.
His nurse probably needs this book. It has the
It has
signed
consent.
papers.
My nurse will probably get that. I
Okay.
brought him with me, if that's okay. Do you have any questions for me that I might?
No, I
No,
understand.
you're fine. No, go right ahead.
I
wanna
understand
get
what's
this
going to
done.
happen.
Okay, did Dr. Castnevis come up today and speak with you?
Oh, yeah.
Several times, probably.
What
Like
you
Dr.
got
Castnevis.
This is the, Daddy, this is the cap. This is where the cardiologist is going to go in and just see what kind of shape your veins and everything's in your heart. Okay? He's just going to check and see that everything's okay in there.
Okay.
This is not, I mean, it's, it has its risk, but this is, you'll be fine. Don't you worry.
Well, I'll be asleep.
You'll be asleep. They'll put you to sleep for it, and I'll be here when you get back.
We have our waiting
I love
area
you.
downstairs where doctor will come to speak to you after the procedure if you'd like to come with us. We'd
Okay.
love for you to do that. It's just closer for the doctor to get to you after the procedure. real quick and
Understand.
Explain to you if that's all right. I'm guessing Dad doesn't
Will he come
walk.
back to this room?
Yeah, I believe
Okay.
so.
Is this what Dr. Lee was talking about?
No, Daddy. This is what your heart doctor was talking about.
Oh, yeah.
Yeah, the cath that you've been waiting for.
Does he walk at all?
He hasn't been walking. They haven't been wanting him to.
Right. I understand. I just want
Yeah.
to be sure how we arrange the beds to get him from one bed to the other for transport.
He can probably stand up.
Hold off on that one. Dr. Lee wants to have the bone scan first.
Oh,
Yeah. So,
Okay.
yeah.
well,
Yeah.
even though you might not be a Miss Taylor, I'm sorry that you get to go with me right now.
No. Bone scan first.
Will they? But they'll still do the cath right after.
Yeah, that's the plan. That's the plan.
It's not going to postpone it too much.
No, ma'am. It
Okay.
shouldn't. It shouldn't be.
Okay,
All right.
That'll be up to Dr. Koshnevis.
I understand.
And he may see the bone scan and decide that he doesn't want to do the cath at that point. Just so you have an idea, that could happen.
Okay, but somebody will let me know.
Absolutely. Would you
Okay.
agree with that? What's that? He's going to go for his bone scan first. we're probably not gonna be standing here waiting for him when he comes back. We're taking him straight from the bone
Right,
scan.
'cause we got other cases going too. We're just gonna
And
slide
so-
it in.
I understand.
We were ready,
I know.
just
Thank
like
you.
y'all have been too. Yep.
Yes.
Mr. Taylor, pleasure meeting you.
Well,
Sorry
I'll
you're not
see you
going with me
again.
right now.
So when they call us, we'll try to get some stuff figured out for you, okay? Well, hopefully like I said, between now and by the time you have all that stuff done, hopefully we got some stuff cleared out with us. So that hopefully that's not going to be the issue at that point.
Okay.
Yeah. Okay? Just let us know. Where you going? So bone scans first.
Okay, so I'm on this case today, so I'm gonna help you with whatever you need. Okay, I apologize for that. I'm the case manager. I normally arrange family meetings. Larissa did that yesterday. This is her unit. I'm the ICU case manager. But whatever you need today, I'm gonna get you my name and phone number. If you need a question, if you don't get the heart cath or you wanna know what time the heart cath is, I can call down there and get it. Find out. I can call Dr. Koshnevis and find out, are you going to do the heart cath? What time are you going to do the heart cath? Can you come talk to the family? Okay? So I'm going to get you my name and phone number. You call me if you need anything. I'm sorry that this has been the way it's been, but hopefully we can get this figured out. And I'm glad that Dr. Lee showed up for you.
I am too.
So let me get my name and phone number for you, okay? And he'll go down for that bone scan, and then once he comes back, I'm gonna ask her to call me, and I'll find out about the heart cath for you if you don't already have an answer.
Okay, thank you.
Okay?
That is the kids ride on.
I'm just almost starting to agree with you, Daddy.
Would you like me to close this door?
Please.
They want doing a big thing. That's all they want.
Hey dear, there's one other place that we forgot that they had checked. It says cardiac catheterization. It's right there, my dearest. Oh, you still have to
Oh,
get-
okay.
Yeah.
What is your name?
Edmund Taylor,
Birthday?
January 29th.
And when are they coming for the scan now?
It should be, well, they injected them maybe about 10, so they should be coming about 1.
For the scan.
Uh-huh.
And what time is it?
12:30?
And they couldn't have done the heart cath
No,
before
because
then?
he has to lay flat for the heart cath.
Oh, okay.
That's why. Okay.
Call,
Extension 875 something.